Hello dear patients, today we are going to review the clinical case of chlamydia in a man after oral sex. A young man came to us, he had discharges from penis, they were particularly strong in the mornings, they were of mucopurulent character. From time to time they left sticky discharges on glans penis. This man had a sexual contact before, this contact was oral, with a woman, and this woman didn't complain on anything. This man didn't have a usual vaginal contact. These discharges appeared 7 to 10 days after this sex. There was burning, itch and increase of urination frequency. Smear test for inflammation was taken. PCR analysis for sexually transmitted infections and culture tests for bacteria were taken. So, what was found? First of all, leukocytes were found in smear test for inflammation. They were up to 30-40 within a visual field. Chlamydia were found in analysis for sexually transmitted infections and in culture test for bacteria. Oral streptococcus was found in high concentration, 10 to 7th power. Then we took blood tests for antibodies to chlamydia and they were negative. This indirectly indicates a fresh infection, and this is also suggested by previous recent contact. Girlfriend of this young man was checked for chlamydia and for all sexually transmitted infections, and smear test from vagina for chlamydia was negative, but it was positive from mouth. She also had positive immunoglobulins A and M for chlamydia, which also indicates a fresh, relatively recent infection, but this is a separate story. So for this young man, a diagnosis of acute chlamydial urethritis was set, and the classic treatment was done. This is therapy by antibiotics. This is instillation into urethra. These are enzymes medications by type of chymotrypsin, longidasa, and these are immune medications. Washings of urethra were also done. As a result of that, these events completely resolved, and after required 3 weeks after treatment, a control analysis was taken, and leukocytes normalized as a result, and chlamydia disappeared from smear test. What does this case tell us about? It tells us that during oral contact you can also get infected by a range of infections. In our practice we observed all infections in mouth, maybe except for trichomonad and Gardnerella, so we usually don't take analysis for these infections from mouth. But other infections, including mycoplasma, ureaplasma, that are not covered in literature, are found in some cases in mouth. So you can get infected by almost all infections during an oral contact. Many young people think that these contacts are safe, they don't use condom, and this leads them to appearance of such infections. If any complaints on discharges, burning and itch from sexual organs appear, you can consult venerologists, urologists and gynecologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such complaints. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.